Our session, Reinventing Skilled Nursing. Through AI, technology leaders on what comes next is now starting in the session room.
All right, welcome everyone. Thanks so much for joining us today. I'm excited for a fun session talking about AI in healthcare. We were just talking as we got up on stage. It's pretty wild. We live in a world now where a quarter of the Super Bowl ads are about AI, and it's really the hot topic of the last few years. And what I love so much is that I think healthcare is truly the perfect industry where we can really see AI truly impacting people's lives, and our two incredible guests here today are going to talk about that more. Especially in skilled nursing, where really AI has moved beyond just a hype cycle, and we're in a moment of real accountability and real use cases. Margins are tight, staffing is stretched, the stakes are higher than ever before, and this is where AI can be a true partner and a co-pilot in all of this. I think we can all agree that what's exciting about AI now isn't just the tech itself, it's the opportunity to really support the people in healthcare, the people on the front lines of the industry. And when done right, it can really reduce a lot of the major challenges and issues that all of us are facing in our business for both staff and residents. So today we're moving past buzzwords, we're moving past just theory about AI, and we're going inside skilled nursing facilities to see how our two incredible guests are thinking about this technology and using it on the front lines, and what a world of AI-enabled care truly looks like when it's adopted successfully. So without further ado, I'm excited to be joined by two leaders who are building in this space every day. David Pesis, Chief Product and Technology Officer at Point Click Care, and Will Plurd, CTO of Apploy. So let's jump in. All right, David, Will, first of all, great to have you both here.
Absolutely.
Thanks for having us.
All right, first question. When it comes to AI in skilled nursing, what problem do you think must be solved first for the technology to really do its job?
The first thing that's most important is the AI is only as good as the data underneath. So if you have bad data in the AI, you're going to get bad results. And so how do you bring all that data together in a way that the AI can be productive? And so how do you bring that acute data, that long-term post-acute care data into a single place to really power that AI? And that's really a big first step. The second thing we look at is, you need a stable workforce. And so, one of the reasons why we're partnering with Apploy is, they're working on stabilizing workforce management tools. If you constantly have turnover in your workforce, it's really hard to drive adoption within your organization. And then finally, people are burned out, right? The nurses are tired. We hear that again and again and again. And so how do we build AI that's so easy for them to actually use, get rid of that administrative burden so they can do things that they want to do, like taking care of their patients rather than doing paperwork and administrative work. And so those are the kind of like three things that we're looking at real closely.
Yeah, I love that.
Yeah, from our perspective, we're focused on addressing the staffing shortage. There just aren't enough folks deployed in the right places to provide care. And there's a lot of opportunity to take friction out of the process of finding the folks that are available and getting them deployed with a schedule that honors their shift preferences and things like that, so you can retain them and prevent turnover, because it's very expensive when you have turnover, and the turnover rates are very high.
Yeah. I think these are great perspectives, and for what I'm hearing from both of you, I feel like AI has to solve real immediate pain points in order for it to be something that can really be prioritized and adopted. So I'd love to, maybe we can go a little deeper and just hear exactly how you're seeing AI being used to actually create fast relief and actually make a difference on the front lines.
It's actually funny, you think about 2-3 years ago when we used to talk about AI, and we were going to solve these huge, massive, complex problems. And that's coming, but also you got to start small and get some little wins up front too that deliver enormous ROI. A couple of examples are documentation. I mentioned earlier, we're using tools now to look at risks, detect risks proactively instead of charting, so that the nurses don't have to be nervous that maybe they are uncompliant, and so we can really do that easily. We have something called resident status, which just gives a snapshot of the patient's medical record. And that's so easy when a nurse is going from room to room to room, how they really easily ramp up on a status of a resident so that they don't have to dig through charts. Another one is referrals, right? We're trying to drive volume into all of our facilities, and so how can we easily make it so that facilities and operators can easily ingest these new referrals without having to go through piles and piles of paperwork? And so those are three areas that are really, fairly simple for AI to make a lot easier.
Love it.
Right. And for us, as we think about the staffing shortage, there's a lot of competition for resources. Getting the right job ad and job description out into the market that's going to attract, not just make a facility appealing to a care provider, but to the right care provider. So it's a good match, it's a good fit. And so, when it comes to content generation for job descriptions, you can spend, I forget who it was, Mark Twain said that if I had more time, I'd write you a shorter letter. You can spend a lot of time getting the content right to attract candidates. AI can accelerate that, take labor out of the process for you. Also, applicant engagement. It's critical that you're able to engage with your applicant and sustain that engagement quickly and repetitively, because they're busy people, they have busy lives, but also other facilities are going to be interested in attracting them. And we've seen a clear correlation when we introduce automation through AI to engage with the applicants, to have them actually make it to the interview and be hired and not get attracted away to another facility while they were in the middle of the hiring process waiting for a response from the recruiter.
That's actually very cool.
Yeah. That is very cool. Thanks so much for chiming in with that. I'm reminded, seeing your socks with your daughter on it, that this has nothing to do with healthcare, but people always ask me for my use cases of AI, and I think they're surprised that my favorite personal use case is so simple. And it's sharing bedtime stories with my daughter. I have an app where I can literally put in her name and her interests, and within seconds it generates a story that makes her the main character. And I look like hero mom, and it takes 2 seconds. And so I feel like you're right. Sometimes these small use cases are really making the biggest difference.
I actually like that bedtime story, Joe. I'm going to do that tonight with my daughter.
There you go.
Like bedtime.ai. All right, so that brings us to the next question. So how do we introduce AI in a way that the staff trusts it? Because these things make sense to us. We're bought in, but we're in workforces where maybe some people are excited, some people are resistant, some people are terrified. So how do you actually roll it out?
Well, I have a funny story. We released a capability about 3 months ago called AI Assistant. We called it AI Assistant, and nobody used it. Right, the nurses, because there's this a little bit of fear using these AI tools, and so no one used them. We were like, oh man, what's going on? Did we break the product? We were going to do all this A/B testing and try and figure out where we went wrong. And I said, you know what? Let's redeploy and just call it resident status. I think I mentioned that earlier. And it does something really basic. It just gives you either a 24-hour snapshot of the patient record or a 7-day snapshot of the it's really, really simple. And so then we relaunched it, called it resident status, and we had 90% usage across nurses. More than 50% said they were saving more than a half hour per day, just getting this basic summary and it's such a basic use case, right? AI has been able to do this for years. And so by changing the name, making it super simple right there within the workflow, they didn't have to no new credentials, it just worked. Yeah. And so I think that we need to get back to basics sometimes and just win these really basic, easy use cases. I talked about it earlier, documentation, really detecting risks, right? Was there a fall? Was there a wound we need to address? Drug issues. And so those are really easy things that AI can detect and make sure that you're compliant. And so those are use cases that we're having tremendous success right now within our customers. And again, they're just simple.
Incredible. What are you saying?
Yeah, so when I think about utilization and getting people to adopt, there needs to be trust developed, and one way you can develop trust is by articulating the value and have it be resident in the feature. So I'm saving you time in generation of this job description content, or helping capture and make recommendations around your schedule preferences, things like that. If you can reflect back, hey, I saved you 4 hours this week, people are more likely to use the tool. Another thing is transparency. If you can, a lot of times in a large organization, you don't know why you got scheduled at, in second shift on a Tuesday. And AI can help generate some insights into, hey, your schedule preferences say this. We've met your schedule preferences 90% of the time, and you indicated that you are willing to pick up second shifts on Tuesday, and here we go. And then finally, the complexity. You've got to keep the complexity low to using the feature. It needs to be easier to use the feature than to not use the feature when you deploy it to the staff, so that it's just low friction to adopt.
So I think the big pattern that I'm hearing is trust. That trust is the big unlock. And sorry.
I was just saying that you mentioned, but the human in the loop, like the nurses don't want the AI making decisions, right? And so like it's always, hey, it's a recommendation, but we're never going to update the record, at least not today, right? And so always making sure the nurse has like the final say of, whether the AI is making a recommendation and helping, but it's never actually going to make the change or update the record. And so that human in the loop is a critical piece.
It's a great point, and I love the points about just really showing how it's saving time, useful, but like you said, it's not the boss. It's not even on equal footing. It's a tool. So let's shift to talk about outcomes and what we're seeing with AI. So what AI use cases are actually moving metrics today in nursing, not just in theory, like actually happening?
Sure. I feel like I keep talking about the same use cases, but the nurses are going from room to room to room, from patient to patient to patient, and that takes a lot of time. And so they want to quickly ramp up on what the latest status of this patient, so they can deliver the best care. The other thing that we're delivering is something called like PRTH, is like predictive risk score. And so we score the patients that help the nurses determine how much risk. It's actually called predictive return to health, but it's really just like how much risk is this patient at. And so it kind of helps the nurse determine where they should spend most of their time. So things like that are just so easy to surface this score. And we actually see a 25% reduction in patients returning to the hospital, where the score is actually impacting the way that the nurse is taking care of the patient. So things like that, like it's just, again, it's like really basic. It's just the score that's helping the nurse figuring out where to focus time. Referral advisor, I talked about referrals before, like we hear from a lot of operators is like the volume of patients is super important, but also the right patients is super. So they want to get more patients, but they want to get the right patients. And so how do you process more of these? Like there's so much documentation that comes from a referral and from an admission. And so how do we help operators and facilities like process big amounts of data and make sure it's a good fit for their facility? And so we're seeing like a 30% improvement. Like we just launched this thing a month ago, but we're already seeing a 30% improvement in terms of the time spent on ingesting these new patients. So some good.
Yeah, that's great outcomes.
So similar metrics. The time to hire that I talked about before, that materially affects overtime utilization. It affects how often you have to go to agency. And when you have to do those things, there's nurse burnout that goes along with that, because even when you have agency, the fact of the matter is you've got new staff in your building, and you have to other care providers have to support that person.
Sure.
So the faster we can get a qualified clinician deployed on the floor, the better result. And so we've seen significant improvements in time to hire, dropping days out of the process. That has an impact on cost to the facility as well, not just overtime and agency, but the fact of the matter is the longer your position's open, the more you're likely to spend on advertising for the role, but also the administrative costs. So if we can generate job descriptions and if we can improve the applicant engagement, we can take labor out of the process. Administrators then can focus on other areas of the business with their time.
So I'm curious, hearing all this, what are the biggest barriers and challenges that you're still facing right now, and that you think we will face in the future? To why isn't everyone adopting this right now?
Sure.
You want to start?
Yeah, sure. So, we talked about trust, and the fact of the matter is there is this thing, AI aversion, that some people have. Mm-hmm. It's novel to them, and They may not have, seen the benefit yet, and as a consequence, when they hear other people talk about, data security and things like that, then they might be resistant to adopting the tool. So the way you deal with some of those objections are one, be first-class protectors of the data in our system. Point-click care obviously has tremendous experience protecting patient data. We have a wonderful experience protecting PII and the like, and so we can ensure and support our ability to protect that data, but also the fact of the matter is some people are worried about job security. Are you going to make my organization so efficient that I might lose my job as a scheduler or recruiter? The fact of the matter is that this industry, long-term care, post-acute care, skilled nursing facilities, they require efficiency to grow. You can't increase your census without operational efficiency.
For sure.
So this is about not just doing more with less, but avoiding doing more with more to put yourself in a position where you can support a larger census.
Absolutely. What are you seeing? Challenges?
There's a couple things. Sometimes we think like if you build it, they will come. Right? If you just give these AI capabilities, everyone's going to use them, and that typically doesn't work with any type of software. And so, one of the things that you want to do is how do you get some super users, like power nurses that are using these things and they can teach other nurses how to use these capabilities. And that's something really important that I would think about is how do you get some really high-powered nurses doing this stuff to train others. Like you got to stabilize the workforce, right? Like these 84% turnover rates, some facilities, experience year over year. You have to stabilize the workforce because if you keep turning over, it's really hard to drive deep adoption within the organization. Customers don't want to log into another tool. Like they want to do stuff in one single place, and so when you give them another set of credentials, they need to go get help from AI completely separated from where they are, like that's frustrating. So you want the AI embedded in the workflow. Whatever they're doing, you want it embedded right there, and that makes it a lot easier because they're in a rush, right? They're trying to get done a lot, and so if the simpler you can make it, right there within what they're trying to do, that makes it easier as well. You also do need you need leadership to push for it, right? You need leadership to sponsor and encourage use of AI, and that's not to take people's jobs. It's to help make their lives easier.
Yep.
Right? It's to reduce that administrative burden so they can get better care. And so there's this fear, oh my God, if I use AI, is my job going to get replaced? And like we need to shift. The thing I like to say is you're not going to lose your job to AI. You're going to lose your job to someone else who's using AI.
Right.
And so like use it to make your job easier and reduce that administrative burden so you can just be better at taking care of patients.
That's right. I had a conversation with my teenage son the other week that I felt like was like a perfect analogy to what we're talking about in AI. He goes to one of these New York City prep schools where they have a ton of homework in high school, and he was like, Mom, did you have this much homework in high school? And I was like, yes, but I had that much work because I had to handwrite my essays. And I was like, what a waste of time. Like that, when I think about how much time I wasted handwriting things because they were like, putting it into a computer won't like give you the same education. Like computers are way better at that. And I'm like, yes, now you have the same amount of homework, but look at the breadth of what you're doing and what you're learning with that time is so different. And I feel like that's kind of that's the hurdle we need to get people over with AI is we're still in like the handwriting phase, and we need to get people to the point where they're letting the computer free them up to do bigger things. All right, so I think, you're citing some great examples. I feel like there are a lot of companies out there, though, that are like using AI just to use it, and it's actually adding more friction rather than ease. So how do we make sure that that's not happening, that we're not just using it just to say we are?
Yeah, we call it like AI washing or agent washing.
Yeah.
I think it goes back to the beginning of the conversation, like start small, like get small wins. And I actually think what's cool is, we all think we're so smart, we're coming up with all these great AI ideas, but really what's going to happen is as these facilities start adopting AI more broadly and start using it, get these small wins, they're going to be, oh man, what if I could do this, or what if I could do that? And so I think like starting small, like do not try and boil the ocean, get them comfortable using AI, getting those recommendations, building it into their workflows. The more that you can do that, people are going to get more comfortable. They're going to come up with more ideas. There's going to be enthusiasm. We're going to build on those ideas. And so you got to get the flywheel going.
Totally.
But the only way to do it is to start small and get some little wins.
Yeah. Do you think you need like some champions inside?
You need the champions. Like you absolutely need to get those champions. Like they like core group of power users.
Yeah.
With the small wins, and like that becomes contagious. That becomes like the nucleus within the organization, where hopefully it can spread.
Yeah, I feel like it can't come from like the top down.
Yeah,
being like use AI.
My view is that that the evidence of the impact of AI will be immediate. The fact of the matter is folks who work in these facilities tend to be oversubscribed. It's not like they're going to sit around doing nothing if AI helps them do their job. The organization will be more efficient as a consequence. Their staffing ratio compliance will improve over time. Their turnover rates with their staff will go down if they have stability and predictability in their schedules. Their overtime utilization, agency utilization will go down, their costs will go down. They'll all be measurable. We're looking to make sure that that's reflected when you use the tools, so it encourages you. Good job. You help the business, you help yourself.
Okay, so if someone is sitting in this room or talking to someone outside in a skilled nursing facility, and they want to know where to start, what are a few things to start or a few things to measure right off the bat, what advice would you give?
I think measuring, you got to look across a few metrics, like operationally. How many patients are we able to get into the door? Am I able to get more higher utilization or census data as a result of this would be one. Clinical outcomes, right? Are you reducing the return to hospital, right? So are you able to get better clinical outcomes by using these capabilities? Looking at staff burnout and staff shortages. Are you able to, I don't want to step on your toes, but that's a big one that we should look at. And then, what we're going to start working on here soon too is how do you get better reimbursement, right? And so how do you make sure that things are being done correctly so you can get better reimbursement with MDS and things of that nature. And so it's going to be really, it should be very black and white on how AI is impacting these metrics and seeing like dramatic improvements in these facilities.
Yeah.
That's right. Yeah. So we, in addition to the things I just talked about, we're looking at utilization of the tools, and is on even a transactional level, is it improving outcomes? So if we think about engaging with applicants, it matters what you say to them. That we handle millions of communications between recruiters and applicants every month, and we have a tool that helps optimize that communication. We don't do it automatically. We make recommendations, things like that. But we measure, are they more responsive before we optimize or after we optimize? And then we learn. We look and see what are the outcomes for each different type of optimization, and then put that back into the tool to ensure it gets better over time.
And what would you say is a realistic way you would roll it out? Like what are you thinking, time frame? Who would you start with in the organization?
It kind of goes back to that, start small, right? Like make sure, because every organization has a little different type of workflow, different way of doing business, even though it's the same piece of software. But I would start small with a smaller group and like let them play or use that thing and like get the kinks out, right? We made a lot of these mistakes early on, rolling it out to everybody, before really getting those kinks. And so like start small, get those power users, get some top-down leadership. Like that's not the silver bullet, but you need the top-down leadership in conjunction with like starting small and get those wins and then start rolling out. Like that's a really good way to do these things, to make sure you fix some of that friction before you go bigger.
That's great advice.
Yeah, David talked about it before. One, embedding it in the existing workflows makes it easier for folks to adopt. Two, think small ball to get them to trust it, and then work with a segment of the users that are a little bit more entrepreneurial when you go to deploy the solution. But then also, the goal aspirationally absolutely is to have the system be able to take action on people's behalf. in an automated way. But don't start there. Look at making recommendations, providing insights first, and then look at automation later.
All right, you guys have done a great job talking about how we can implement AI right now, what some of the challenges are. Let's future look for a little bit. Where do you think AI will be in our organizations in 2 to 3 years or beyond? And what are you hoping?
This is my favorite question.
Okay, great. Magic 8.
Because I go to bed thinking about this every night. Like many of you are probably wondering like how I look so good, and
I was wondering that. Yeah.
And that leads me to the. So I'm only half joking, but so I wear a glucose monitor. I'm not diabetic, but I wear a glucose monitor. Like I monitor my blood pressure. I put my weight into Apple Health, and so I do this fairly regularly. And for someone that, hopefully some of you know this, but Claude is an example. I can pull all my Apple Health data. Yeah. And so I can actually go, Claude's like a version of ChatGPT. So I can go to Claude and say, hey, can you trend my blood pressure versus my glucose, versus my sleep patterns and see if you see any trends. And it'll make graphs on the fly. Like, hey, David, like you drank 5 shots of tequila this night, like you didn't sleep so well and your blood pressure's way up, right? I'll find these, I'm joking about the tequila, but like you can actually really graph these trends. And it made me think like, why don't all the nurses, the frontline caregivers, have that same access, right? And so, the term, I think you see James over there in the corner, we call it Chat PCC. But like one day, like you should be able to go to Chat PCC, like, hey, how's my patient doing? How are they trending? Right? How's their blood pressure looked? And create a graph or a chart right there on the fly. That's really the future, where all that data is at the caregiver's fingertips. Like we have to get there quickly. I believe that's where we're going. The other part I get excited about is a touchless EMR, where like the caregiver can go into the room and like they don't have to interact with it because you have ambient listening, where that's listening to their voice, so they're able to update the record. I was talking to Tapestry Health. They're using radar. They're actually using radar to watch patients, and they can detect heart rate, respiratory rate, if they fall, and that data automatically gets put into the chart. And so there's these things that we can do where like we should get to this point where there is a touchless EMR, where again the nurse can just focus on giving care, and not all this administrative stuff. And we're going to get there faster than you think. Yeah. So those are a couple of things that get me fired up.
That's awesome. You're like, I'm actually 90. I just look.
Yeah, I mean, like.
Yeah.
Yeah. So from our perspective, we're looking to expand the footprint of data that we can bring in to anticipate hiring needs, so that because a stable schedule starts with being able to anticipate changes in census and then deploy based on the right acuity, get the right care providers in place at the right time. If you can look ahead, both the frontline worker benefits if 90% of the time you're honoring their schedule preferences, they're not going to leave. They're going to be happier there. If they're more likely to not have open roles that are causing them to have to work overtime or causing them to be working with new staff, they're going to be more likely to stay in their spots. And as a consequence, you'll be able to provide higher continuity of care. So to get there, we want to be able to take more acuity in clinical data to be able to inform hiring plans and schedule generations, so that you get happy, efficient staff providing care. We want to be able to feed that data back so that the business can understand the availability in different markets of different acute dementia certifications, things like that. So you think about how it is that you want to build your census based on what's going to be available in your market.
Right. I think in a moment we'll have time for probably 1 or 2 questions from the audience before we wrap. But you got me thinking a lot when you were talking about healthcare, because the last time that I was here at this event in Phoenix, I had just had hip surgery. And I just ran my first marathon back after hip surgery, and obviously had approval from humans, from doctors and a coach. But after human approval, I Claude, I put in like, here's how I'm recovering, here's my last 4 weeks of workouts. What do you think I can run? And here's the course profile, and it predicted my marathon time within 10 seconds of what I ran.
That's amazing.
It was incredible. So I feel like it really gave me a glimpse of what we can expect in the future, which is exciting. So any questions from the audience before we wrap with our experts? Yes?
Good questions only, please.
Good afternoon. I have a question, AI. How is it being handled or viewed or looked at or evaluated when it comes to liability, especially in SNFs, okay? When you have plaintiff attorneys and everybody looking at the human touch, the human assessment, the human answer, and you have AI and, maybe AI's outcome causes harm or causes a problem. How is that being handled? And is it third-party liability or liability with the facility?
Oh man, I wish we had some. I'm sure there's a lawyer in the room. I actually don't know the exact answer to that question. I know that we're super careful. I know that there's some indemnification, but I don't know the specific answer.
I mean, there are huge AI departments inside of law firms that are growing now. I mean, it's an incredible new field.
Yeah.
I'm gonna defer answering that question just because I don't have I'm the nerd on the stage. We need a legal expert. Yeah.
So there will be an evolution of compliance standards around deploying AI. There is a NIST AI risk management framework that describes exactly what it is that you're talking about in respect to security, ethics, and efficacy of the outcomes and accuracy of the outcomes. I think that you have to proceed with caution, and we have, where we've been very intentional about understanding that the outcome is non-deterministic, to use a technical term, which means this is a recommendation, it's an insight. AI can be wrong, and you need to be aware that there's a human in the loop, but there's a human in control. Yeah. And that's the way that we build the solutions into the software until we can ensure that we are providing this safely. Now, there's things we do behind the scenes where we'll use multiple models to validate and do cross-validation, things like that. But it's emerging.
Yeah, we're definitely in a messy middle. I had the opportunity early on to invest in Anthropic, which was a good personal investment to make. And then a week after making that investment, my book publisher emailed me, "Do you want to sue Anthropic because they're scraping your book?"
Right.
And I was like, wow, well, that's an interesting situation.
Sure.
And I did not sue them. I was like, I think I'll do better from the investment than from the lawsuit. But with no doubt, we're in a very messy middle, so great question. Sorry. Yes.
Just follow up.
Yeah.
I don't know if you have experience with it, but what are insurance companies doing with facilities that have AI models?
Yeah.
How are they coming up with the premiums, or is it a good thing? Do the premiums go down, or the premiums going up?
Yeah.
I do know there's a few states that are actually I don't have the details of like the numbers, but there's a few states that are actually giving lower premiums if they use, for example, like a chart advisor risk management capability within PCC. And so I think you're going to see, like, that's actually an avenue we're exploring. Like, the insurance companies love these risk features that AI is driving because they're reducing risk due to falls, like I said earlier, drug use, wound care, et cetera. And so I think you're going to see a reduction in premiums as a result of implementing AI and having better outcomes.
Awesome. Yes, right here. All right, our favorite topic.
I love the law.
I don't know the status of the appeal, but I know PCC lost an interoperability lawsuit around CAPTCHAs recently. How do you view interoperability and the innate fact that people need AI because workflows cross technology platforms, and how do you balance risk and actually openness and not become epic?
It's actually like that's besides the sniff of the future. That's on my mind a lot as well. I think that what we need to balance is the risk to our customers. And so if you have these bots scraping or someone hammering an API, right, that puts a massive load on our infrastructure, which impacts our customers, right? And so like we have to protect our infrastructure to make sure that like the PCC still stays operating. What we need to invest in is how do we make sure that you can get access to that data in a way that's scalable and doesn't endanger other customers. And so that's something we're doing aggressively. So like ideally you're not scraping, right? Ideally you're calling APIs and getting the data you need so that you can perform the work that you want to perform, and that's where we're going. But so that's this fine line, giving our customers or third parties access to the data that they need in a scalable way without putting our customers in danger. And so we're moving quickly, down that path. Does that help? Yeah. Okay.
All right. I'm getting the time. Thank you so much. Thank you both for such a thoughtful conversation around AI and skilled nursing facilities. The future is here, and it's a pleasure to share with all of you. Thank you so much.
Thanks, everyone.
Bravo.